Hello, I'd like to share some information with you today in regards to emotional detachment. This information is coming from verywellmind.com, written by Kendra Cherry and medically reviewed by Carly Snyder. So, emotional detachment, what is that? It refers to being disconnected or disengaged from feelings of other people. This can involve an inability to or an unwillingness to get involved in the emotional lives of others. While detaching or feelings of emotional detachment may protect you from stress, hurt, anxiety, it can also interfere with a person's psychology, social, and emotional well being. So, emotional detachment can sometimes occur as a coping mechanism when people are faced with stressful or difficult situations. In other cases, it can be a symptom of mental health conditions. So here are some examples of emotional detachment: difficulty opening up to other people, ambivalence towards others, avoiding people, situations, activities, difficulty empathizing with others, not paying attention to others, losing interest in people, activities, losing touch with people, preferring to be alone, poor listening skills, problem forming and maintaining relationships, struggling to feel positive emotions, problems expressing emotions. So it's important to remember that emotional detachment is not a mental health condition, but it may be a symptom of a mental health disorder. So identifying emotional detachment. So I want to impress upon some symptoms can be a response to an acute but temporary situation, and or it may be a sign of a mental health condition. Your doctor or a mental health professional can assist you and support you through the that piece. So the doctor will look at your health history, evaluate your physical health, and rule out any medical conditions. A doctor, therapist will ask you questions about history regarding feelings, moods, behaviors. They'll ask, whether or not um, these symptoms are impactful and how they are impacting your life and how long they've lasted. So, some causes of emotional detachment can differ. These can include past experiences of psychological conditions, but it can also be purposeful behavior that can be used in a way to cope or set boundaries in overwhelming situations. So, some mental health conditions that emotional detachment symptoms can fall under can be PTSD, personality disorder, bipolar disorder, depression, to name a few. So there are medications that can possibly assist an individual. Definitely speak to a medical provider that can assist you in prescribing the most appropriate medication. So there are also some voluntary behaviors when detached emotionally, emotions kind of come up as a way of coping with stress, establishing boundaries, and reducing feelings of anxiety. It can sometimes be a positive coping mechanism in cases where you're facing temporary problems, issues, concerns. And though it can be problematic if it becomes overused, um, like an overuse pattern of behavior that affects the ability to form healthy relationships with other people. So, here are some tips in regards to symptoms of attachment disorder. So, some emotional detachment, having those symptoms with mental health can be a reaction or reactive attachment disorder, as well as disinhibited social engagement disorder. So there are treatments. So there are different approaches, different treatments to address emotionally detached um, symptoms. Your doctor, your mental health provider will evaluate, assess your symptoms, and may diagnose um, appropriately to determine what the treatment plan can possibly be. Some treatments plannings can be CBT and or ACT or ACT, excuse me. So there's also a piece of coping if you're experiencing emotional detachment. Practicing mindfulness is a technique that assists people in focusing on the present moment, including the physical and environment and the emotional response. Also, strengthening your relationships. Kind of as you build or begin to build greater awareness of your emotions, it's important to find ways to connect with safe people who support your growth. Also, finding ways to become emotionally vulnerable, learning how to open up. Take some time. Surrounding yourself with safe people who understand your needs and are willing to give you the time that you need to gradually work towards improving your emotional experiences and expressions is important. So, emotional detachment can occur for a number of reasons. Um, and uh, it can also occur due to effects of trauma or symptoms of mental health conditions. If you're feeling as though emotional detachment is negatively affecting your life and ability to function, please speak to a doctor and or therapist because they will be able to assist you with treatments that are available um, to assist you in these important areas of your life. So I hope this was of assistance for you today and enjoy the remainder of your day.